The study continued to say that there have been over $8 billion of additional cost. I wish you could have had the conversation with the people of Massachusetts a long time before that phone call would have been with the President Obama, because the fact of the matter is you are for individual mandates, and you can get up and stand up and talk about, you know, I'm against it now and I'm going to rescind Obamacare, I'm going to repeal Obamacare, but the record is very clear. You and Newt were for individual mandates, and that is the problem. And the question has been, who can stand on the stage, look Obama in the eye, and say Obamacare is an abomination for this country, and I'm going to do that. And I can take that fight to him and win that fight.
Governor Romney, a 30-second response.
A good deal of what you said was right, some is wrong. Speaker Gingrich said that he was for a federal individual mandate. That's something I've always opposed. What we did in our state was designed by the people in our state for the needs of our state. You believe in the 10th Amendment? I believe in the 10th Amendment. The people of Massachusetts favor our plan 3-1. They don't like it, they can get rid of it. It's a great thing about a democracy where individuals under the 10th Amendment have the power to craft their own solutions. By the way, the problem with President Obama's plan is it does three things we didn't, in my opinion, among others. I understand we disagree on this, but among others. One, it raises taxes by $500 billion. We didn't raise taxes. Two, it cuts Medicare by $500 billion. We didn't do that either. And three, it doesn't just deal with the people that don't have insurance. It's a 2,000-page bill that takes over health care for all the American people. It is wrong for health care. It's wrong for the American people. It's unconstitutional. And I'm absolutely adamantly opposed to Obamacare. And if I'm the President of the United States, I will return to the people and the states the power they have under the Constitution, and they can craft the solutions they think are best for them. And my view, you had a mandate in your state. You mandated the girls at 12 years old had to get a vaccination for sexually transmitted disease. So it's not like we have this big difference on mandates. We had different things we mandated over. I wanted to get people health insurance. You want to get young girls a vaccine. There are differences.
I'm listening to you, Mitt, and I'm hearing you say all the right things, but I read your first book, and it said in there that your mandate in Massachusetts, which should be the model for the country. Now, I know it came out of the reprint of the book, but, you know, I'm just saying, you were for individual mandates, my friend.
You know what? You've raised that before, Rick, and you're simply wrong.
It was true then.
No.
It's true now.
Rick, I'll tell you what. $10,000? $10,000 bet?
I'm not in the betting business, but
okay.
I'll show you this. I'll show you the book.
I've got the book, and
we'll show you.
and I wrote the book.